Welcome to the Dental Hygiene Basics podcast. My name is Dana. I am your host, and I'm very excited to have a special guest on the podcast today. I'm very excited to introduce Stacy Weisman. She's here, and she's going to talk to us all about just her traditional path into dental hygiene, but then also a lot of amazing things that she's done afterwards. So, Stacy, I'm going to let you take the floor. Tell me basically your RDH origin story. How did you get to this point in your life? How did you decide you wanted to become a hygienist? And we'll go from there.
Sure. No, I love that, Dana. So as a kid, really growing up, I loved going to the dentist, right? And I feel like this is where a lot of hygienists start, right? They either have ortho treatment and they love going to the orthodontist. And I just had an amazing dental hygienist growing up and just was obsessed with teeth, right? When I tell you obsessed with teeth, this is how it really started. So when I was about 5, 6 years old, my dad had his wisdom teeth taken out and my mom was too grossed out to change the gauze in his mouth. And being the daddy's girl that I am, I hopped right up, got that gauze, changed it out. And ever since then, I was just always so interested in looking at teeth and in people's mouths. And so, having that conversation with my dental care team, growing up, they were like, you should be a hygienist. You should be a hygienist. You should be then a dentist and all the things. And so in my mind, I was always going to be in the dental field. So how my education started was that my senior year of high school, we had a VOTEC program. And so I was going back and forth, like, do I do dental assisting? Do I take AP courses to then get me, ready for college and into dental school? And I ultimately decided on dental assisting. And that's really where my love started. And I was like, there is nothing else that I want to do than work in people's mouths. And so I graduated from the program and got early acceptance into a dental hygiene program. Penn College of Technology is where I had graduated from. And again, with dental hygiene, you usually do your 1 year of prereqs and then you do your 2 years of hygiene school, or at least in Pennsylvania, that's how it's run. And so I had gotten through one semester of college, again, was then put early acceptance into the hygiene program, was directly into there. So there was really no struggle, right? And I know a lot of people do struggle with kind of going into that hygiene program, but it's really that perseverance that pushes you, right? And I knew in my mind that there was nothing else that I wanted to do. So this is where it led me, is that I really focused on my education and really focused on getting that early acceptance into the program. So then I didn't have to worry about it going into the next semester. And so with that being said, once I had graduated dental hygiene school, I then went on to get my bachelor's degree. Now, again, as a clinical hygienist, you really only need an associate's degree. And to be honest, for 20 years, I really only was a clinical dental hygienist. And so I really only needed that associate's degree. However, I am glad I did go on to get my bachelor's degree right after that education. I then transferred to Westchester University in Westchester, Pennsylvania. I then got a bachelor's degree in public health. And then I minored in chemistry with the thought of going on to dental school. And I then went on to attend Rutgers University and start a master's degree program through there as well. Things happened and I actually never graduated with my master's degree. I did all the dissertation, had my 25 credits, and then for a reason I had to miss my dissertation. They wouldn't reschedule it, and it was like this whole thing. So anyway, I had all this background. I then transferred to Idaho State University to get a dental hygiene degree, specifically in education. I got 12 credits in. I'm like, I do not want to get into education. Like, I love dental hygiene, but like that education part is just not for me. So I was living in New Jersey at the time. I then moved back to Pennsylvania, where I had practiced for, another 12 years. And in a clinical practice, same practice, where we did a lot of cosmetics, we did a lot of prosthodontics. So that really was exciting to work with these patients with difficult dental needs. At that time, I too was then able to get certified as a school dental hygienist. So I was able to contract with schools and work on that public health part of the education that I had had. And what I would do is I would go in, do oral health educations. I would do screenings for these kids because in Pennsylvania, we need screenings for entry of school, for kindergarten. We also need it for 2nd grade, 5th grade, and 8th grade. So there's a lot more screenings that go on. Now I'm in California and they only need one screening. And I'm like, we need to screen these kids more. Early caries or childhood caries, it's still the number one chronic disease that we see in children. So hygienists definitely have other places, outside of the op. So anyway, so I was also a public health dental hygienist in Pennsylvania as well. So I was able to do education in nursing homes, go do screenings, cleanings in nursing homes and things like that. And more of like the portable or mobile dental hygiene. Yeah. So then years later, had my first child. We then moved to California. I've been practicing as a clinical dental hygienist in California for the last 7 years, doing that one day a week about, and then kind of transitioned into a little bit of the corporate world. So if you want to go into that, Dana, I'm
I
happy
would
to go
say,
into
yeah,
that too.
just give us the full story because I know I'm going to want to dig into little bitty pieces.
Sure. So because I love clinical hygiene, I still do one day a week, full day clinical hygiene. And then I am also working for 2 different companies where I'm doing lunch and learns and CEs for them as well. After Under One Roof, where if you guys don't know, that's where Dana and I had met. I actually lined up some study club lecturing for my own content, which is super exciting. Again, for me, I started out lecturing where in Pennsylvania, every 4 years, the Department of Environmental Protection requires dental professionals to get a radiation course, right? So I was lecturing on radiation safety, which I don't know about you, but it's probably like one of the most boring topics that like you've ever been. So right in my head, I'm like, okay, if I can lecture and make radiation safety exciting, then I can lecture on anything. And so I was never a great public speaker. My voice would get shaky in crowds of like over 30 people, and chairside conversations always flowed organically with me and my patients. Like I have no problem talking. In fact, I'm like that one hygienist, right? That like needs to sign on their back. Like don't start a conversation with her because she won't stop talking. But for whatever reason, like that public speaking and getting out on the stage was just really stressful for me, right? Like I would go in very confident, but for whatever reason, like as soon as I would start talking, my voice would get shaky. So I'm like, okay, I need to fix this if I really want to keep speaking. And so that's where I was like, let me get comfortable with being uncomfortable and work for these companies, gain my expertise in public speaking and go from there. So, if you want to start lecturing and don't think you're a great public speaker, like I was not that person either. And it takes work and it takes time. And so, I more recently started to get more comfortable. And then that's when I started reaching out to these study clubs and pitching to them some of the courses that I wanted to talk about and what I wanted to launch. And one of the things that I ran into is like, okay, well, do I become a CE provider? Do I do this, that, or the other thing? But, if you're looking, you have your own content, your own material that you want to lecture about. A lot of these study clubs offer their own CE provider information. So you don't necessarily personally have to get that credentialing before you want to start speaking, right? And that was always my holdup was like, okay, I want to speak. I have exciting things that I want to talk about in the dental hygiene environment that could really help dental hygienists. However, I don't have that CE certificate to be able to present to them at the end. But that's kind of your way around getting to do those things is to have these partnerships with other study clubs or other dental hygiene associations. Like if you're, your ADHA related associations in California, we have the CDHA, and to get involved with those organizations to be able to speak. So I'm working for 2 companies again, doing that. I'm doing my own stuff. I recently became a myofunctional therapist. So I did start my own business in that as well. My business originally started doing nutritional counseling guides for dental professionals. So I love nutrition, overall health and wellness. And a lot of hygienists don't know that nutritional counseling is in the scope of dental hygiene, right? We spent a whole semester learning about nutritional counseling, and it's probably one of the first things that go, right? When we're in private practice, we're so worried about probing and doing a dental hygiene diagnosis or screenings for periodontal disease and getting every little piece of tartar out and making sure that our patient's mouth is healthy. But what I was finding in clinical practice was that no matter how well I was doing therapeutic-wise chairside, if my patients didn't have their health and wellness and nutrition intact, they weren't healing. And that was the most frustrating part for me. So that's where I wanted to kind of make that shift. And there is this big shift in dental hygiene and dentistry and just medicine in general, where overall health and wellness, right? Whether it's our sleep, it's our nutrition, it's, how we are monitoring our stress, it really impacts our overall health. And I wanted to give providers a chance to be able to implement that chair side, and not only to help their patients, but also to help their production too, because we have dental coding that we can actually use as billable sources for our patients to make this eligible for them to have nutritional counseling as a part of their dental hygiene diagnosis and have it part of their dental hygiene treatment and care plan as well. So that's really where my business started, was the whole nutrition part of it. Then rolling into that overall health and wellness, myofunctional therapy, and then offering functional oral health coaching for clients as well. So doing salivary testing, HTMA testing, blood work sometimes, just to get to that root cause. So people are getting frustrated with why they're getting caries, why their gum disease isn't healing. So this is kind of really to dive down and not necessarily diagnose, but to help them find out where they're going to need help with, to not only help their periodontal health, but their overall health and wellness.
Yeah, I love everything you're doing, Stacey. And I love kind of the progression of your career. You work clinically for so long and you have these passions and you're seeing these patients as a whole. Right now, your audience that you're speaking to are future dental hygiene students or current dental hygiene students. That's the bulk of who's listening to this show. And I would love for them to hear what you're saying and really take that into their practice and the type of provider that they want to be. Because I did that when I worked clinically and I still work clinically one day a week. I'm the same. Like I have to be hands-on a little bit somewhere at some point. And I'm mainly working with kids who have extreme caries. And yes, is oral hygiene a factor? Absolutely. But what's the number one factor for these kids? It's diet, right? Nutrition. Yeah. And so, I think for students listening to this, you may be thinking, why do I need to take nutrition or why do I need to take these other classes? I want you to think about you could make an entire career outside of the operatory in just providing nutritional education to patients while still being a dental hygienist, right? There's so many avenues that you could go, and Stacey's doing that, and she doesn't stop, right? Like you just keep building on and adding on, and the more you do, the more you learn, right? And then you just keep kind
Absolutely.
of doing that. I want to make one quick point. I was listening to your episode. We'll give a shout out to our friends over at Functional Roots Podcast, Amanda and Heather. And I think what really spoke to me was that you mentioned, your patients, you're educating them, you're like brushing, flossing, whatever the things are to keep your teeth clean, but you're not seeing an improvement. And so much of that goes back to health and wellness just beyond the mouth, right? The nutrition and, do you have vitamin deficiencies, all of those things. So I want students to hear that and just think on a bigger scale about what we do as dental hygienists. You maybe have a picture in your brain of what a dental hygienist does. It
Mhm.
is and can be so much more. And the more we start to practice these skills, which starts in school, the more we can grow our profession, right? I know you're passionate about the profession of hygiene. I am too. And when I heard your story, all I could think was, this is the future. This
Yeah.
is the future, right? So you said, you're doing salivary testing, wanting to get into blood testing, different things like that, because at the doctor's office, you go in and blood work's a normal thing. Why are we not testing
Right.
saliva at every visit, right? So just a little something for our students to wrap their head around, just what you learn in school. It's the starter. You have to have the starter pack, right? But then you can add on.
Yes.
So thinking about adding on for you, you went back to school, you got your bachelor's, you started working on your master's, and beyond that, you've continued to learn. So I'd love to just know about how you've approached learning at this point in your career.
Yeah. So I love learning, right? And so one of the things, and I'll tell a funny story. So he was 4 at the time, my 5-year-old. He was putting a Mother's Day thing together, right? And it was, what's your mom's favorite TV show? And he like told his teacher to write in there, she doesn't watch TV, she just reads, right? So for me, I'm like, oh, okay. Like at least they see that like I am putting that forth effort into learning. But that's the thing. And so what I recommend, at least for students, especially like those, dental hygiene students that are new grads, it's that you're never going to stop learning. And the great thing about learning post dental hygiene education is you get to find out what you want to learn about, right? So if you want to continue to learn about periodontal scaling and, just have your technique down, you can do that. If you want to learn more about nutrition, there's plenty of information out there. And honestly, one of the reasons I put my nutritional guide out there was because there really isn't a lot of nutrition. At least like when I was starting to look, there was a lot of, okay, like you need these nutrients to help your periodontal health. You need this, that, and the other thing. But there was not anything to implement it into practice, right? It's like, okay, I have all this information. I have all this great information I can share with my patients, but like, how do I pitch this to my doctor that then wants to get on board to implement into the practice and make it profitable for the practice? How can I make my love for nutrition help everybody in the office at the same time, right? Because as the students will realize, once you get into the practice, unfortunately, what we do, it does have to have a price tag associated with it. And what I love about nutrition is it's all here, right? You don't have to purchase anything additional. You don't have to carry a microscope around with you it's no out of pocket. It's just education that you can do for your patients and maybe a paper, to have them track their 3-day nutritional, diet down. But that's one of the things that I love about that. And so, again, with students, it's just never stop educating. I love AOSH. AOSH for dental hygienists, it's like $99 a year membership. And then you have this unlimited vault of continuing education that you can get. There are recorded, some are live conferences that you can attend as well. But there's great information on there just about different oral systemic connections, some nutritional stuff, a lot with kids and airway health, which again, as a myofunctional therapist, I'm big in, children, especially in airway health and sleep and all those kinds of things. So for me, where I would recommend students to start is if you're looking into more of that oral systemic health connection and kind of health coaching and wellness coaching for your patient, AOSH or the American Academy of Oral Systemic Health is a great way to start. And it's a super reasonably fee for the membership.
Yeah, absolutely. I'm going to look into that after this. I was thinking when you were talking was along the lines of, okay, you want to provide these services for your patients, right? And you may recognize something. And like you said, okay, you have the education in your head. Okay, if they have this nutrient deficiency, they may have this oral manifestation, right? So
Yep.
if you have a B vitamin deficiency, you may have glossitis or angular colitis, irritation somewhere in the mouth. Okay, so we tell the patient that and we're like, what is the next step? You should see your doctor and get checked. But what if we could do it right there and get,
Yeah.
a micronutrient or a vitamin deficiency, salivary test or blood test or something and prevent it from even having to go that step further,
Right.
which we
And
can. And that's kind of what you do, right?
yeah. So yeah, that is what I do. And so what I found too, and again, I'm actually lecturing on Friday on a course about this. It's called Med Minerals in the Mouth. And so it's showing how hygienists can, one, see these oral manifestations and then not kind of bypass the physician, but then give our patients recommendations on how to do it. If you go on like Quest Lab or LabCorp, you can literally order your own test, right? So you don't even need a script. Yes, you would have to pay out of pocket for it if you have an FSA, or an HSA if the patient has that, it would pick it up. But the patient can order these tests, right? So we can have these discussions chairside with them and say, hey, if you don't want to have to go back to your physician, you can order these tests online. Here's the test that you would order. Here's the fee for it. Send us a copy when you're done. We're happy to go over that with you. Or again, they can just have their provider write that prescription for him. But again, knowing what minerals and what vitamins that you want to have checked is the starting point, and educating the patient on that too. We don't just want to say, okay, supplement, supplement, supplement. And again, this is like a whole other rabbit hole with the gut health and absorption and all the things, but we do see a lot of these things as oral manifestations in our patient's mouth, And so, I don't know about students now, but I know like 20 years ago when I was in hygiene school, it was the geographic tongue, like etiology unknown, right? And then this etiology unknown. And I'm like, no, we do know what these etiologies are. It's just that there isn't the research to kind of back it. Like we have the studies, but it hasn't quite made it to the textbooks just yet. And so that's where it gets exciting and to come in and to bring light to these things. Whereas for me as a learner, like I want to know, like, I don't want to hear the word unknown where it's coming from. Like there is a source for everything. And so that's again, what was so exciting about kind of uncovering these different vitamin and mineral deficiencies. And I'm like, it's there. It says it right there. Here's the study that goes with it. And so, I'm excited to give my patients more than just like, I don't know. We don't know where it comes from. So I don't know how to help you.
Yeah, I know. I'm super inspired by this conversation. And I really hope that students who are listening feel that passion that you felt for nutrition. But then again, you just kept learning more and more about it. And it can feel like a rabbit hole sometimes. But what you do, anytime you learn something new, you bring that to your practice, it makes you more valuable. And I know that your doctors and anyone that you're working with or who's attending your CE courses are seeing the value, one, because you're passionate, but two, because you keep learning. So something that you mentioned before we started recording is you don't have to continue adding credentials behind your name to continue learning and be able to share that knowledge. So I'd love for you to just speak on that a little bit because I know we're going to have students who graduate eventually, and that's my goal. They won't be here listening to my podcast forever. They will expand and listen to other amazing hygiene podcasts. But I want them to be left with this thought process of education continues, and there's different ways to achieve that education. So, would you share a little bit about that?
Yeah, sure. So recently I started working with a business coach. And, for me, I'm like, okay, I need this certification and that certification and this and health and wellness. I need to feel like I have all these credentials to be able to provide this with my patient. And my business coach was like, okay, stop. You can continue to do this and spend your money on this board certification or this, that, and the other thing. She's like, but look at what you already have and look at all of the education and all the help that you're able to provide your patients without having, a particular letter or number or whatever it is behind your name. And she's like, so just take a minute and pause and focus on what you have now. Sure, you can still continue to do education, but you don't necessarily have to get that education with having a certification attached to it, because usually there's going to be more money and more investment that you put out for that. So I'll give an example for myofunctional therapy, right? So I went through a 30-hour course for that. And, I'm like, okay, I need to go to IAOM and, get my, COM and have that behind my name and this, that, and the other thing. And she is like, hold up, like, look how much money you're going to spend, in addition to that, which again, eventually I will get that. But from a standpoint to help my patients and guide them, I don't necessarily need that COM behind my name, and to be what we call like a certified oral facial myofunctional therapist. So, sometimes in our mind, we get that, okay, like it has to be licensed, it has to be certified, it has to be credentialed. But as long as you are getting that education, it doesn't necessarily have to be associated with those letters or numbers behind your name.
Yeah. And something I was thinking about was we are blessed to have the credentials RDH behind our name. And I think sometimes we forget the power behind those credentials, being a registered dental hygienist. I think a lot of people maybe think, oh, I'm not a doctor, or oh, I'm not this, or oh, I don't have this credential, so people shouldn't listen to me. But our education to become a registered dental hygienist and what we have to go through and, to become one really, I think, gives us the power to stand up and talk in front of people and speak our truth. And again, you can go down and continue and get credentialed if it's a passion. And I think you should, if that's where your brain wants you to go. I think that you absolutely should do that. But I also like that there are alternative pathways, because you mentioned I started my master's. This wasn't for me. Education in that regard wasn't for you, which I think is funny because you're such an educator. You're
And
such
you
an
know what? Every educator I talk to, they're like, what? Like, why would it? I'm like, well, maybe I would do like clinical, like, I don't know.
I get it though, because
Yeah.
I'm the same way. I think some of it is also that entrepreneur spirit and like the conversations you want to have and drive, and like what you want to do is so niche that you couldn't achieve all the things you're supposed to achieve in that particular role. Even though you'd be great at it, it's not where
Right.
you're meant to be. And I totally get that.
I need more than that. Yeah.
Yeah, I love it. I love it. So I just want to say thank you so much for sharing your story. I think this is a great story, very interesting. You are an amazing human being and hygienist. I love what you're doing for not only your patients, but also the profession, and for sharing your story here for our students. So I would just like to know, do you have any final advice? Maybe, former version of yourself, younger Stacy getting ready to embark on this adventure. What would you tell yourself?
So what I would tell myself was probably what I'm telling your audience, right? Is that like I didn't need a master's degree. Like sure it helped me, it educated me. I got to do some awesome fun things like cuz my master's was in biomedical science. Like it was so cool to get all that science background, but you don't necessarily need that, And so I wasted a lot of money, like in just getting that education where if I would have worked full time as a hygienist at that point and, just got involved with other organizations, I would have been here a lot sooner, right? Like I've been practicing for 20 years and it's taken me kind of that long to find out where I really want to be on the health and wellness side of it. So yeah, so I would say like don't put all your money in one bucket, thinking that that's what you have to do for you to be successful. I will say one other thing, like it's always been a passion of mine to be active in associations, right? Like as student members of the ADHA, a lot of that is kind of built into the curriculum. And a lot of hygienists lose that. So right now, I'm currently president-elect for the Tri-County Dental Hygienists Association, which is in, again, California, where we still have components here, which I think ADHA is kind of getting rid of a lot of components elsewhere. But it's so important. If we want to see dental hygiene grow, we need legislation. And that's where our funding goes to. And a lot of, I think, students don't realize that is that your dues go towards making dental hygiene better. And us in these board positions, it's all volunteer. Like, we do not get paid to do this. We love dental hygiene and we want to see it grow, not only for our profession, but for our patients as well. So, again, it's super important to, I hate getting on this pedestal, but it is so important to be a part of the Dental Hygiene Association. And I think for so long, or at least like when I was coming out of dental hygiene school, the board members have been part of the board forever, right? And they have their group and they have their niche and their clique and this, that, and the other thing. And just don't be afraid to be that newbie to come in and help out. They're there to mentor you and to help. I had a really difficult time when I had my first board position, and it shied me away for a really long time to get involved again. And I wish I didn't let it impact me like that. But look at these people as your mentors. Like, they don't want to stay in those board positions forever. They want new people to come in and try to help out. So, pay your dues, get involved. That's how we're going to see things pass. I was lucky enough to be part of like New Jersey and Pennsylvania when they were passing local anesthesia, right? When I graduated hygiene school, hygienists were not taught local anesthesia. 2 years after that is when they had passed it. So it was really exciting to be able to see where our lobbyists and where our legislation was able to head us to advance our profession, to be able to do that. And the world needs more hygienists out there. We need more hygienists in these public health settings practicing on their own and be able to give care to people that need it. So, make sure that you're helping out your components and your ADHA because they need it. And if you want to see it advance, that's what we need to do.
Yeah, big proponent of all things that move dental hygiene forward. And so, yes, you can get on that pedestal here and share that as much as you want because it's so important. We see so many people who are upset with, with the field of dental hygiene and they want advancement, but you have to put the work in to get there, right? Even if it's just that you're a member, right? And that you pay your dues and that you're a part of that. And then when the time comes that you have more free time and you're available and you want to volunteer, it's like, it's hard to sometimes get into those tight-knit societies. It's really, really hard. That's a common thing that I hear from, I felt the same way. I still feel the same way, trying to kind of become a part of it. And then I know a lot of other people feel the same way, but like you said, the torch has to be passed at some point. And so it's good to get out there and it's great for networking. You just feel less alone when you have people who are going through it beside you. Love that, Stacy. Well, thank you so much for your amazing story and words of wisdom. And just tell the students where they can find you and follow you if they want to hear more about what you're up to.
Sure. Yeah. So you can follow me on Instagram. It's Stacy_Weisman, RDH. Weisman's WEISMAN. You could also find me on my website. It's thehygienistmom.com, or you can email me at thehygienistmom at gmail.com.
So thank you, Stacy.
Thanks, Dana.